comparison of MRCUG and RGU, that is micturating cysto-urethropy with, that is comparison of MR that is magnetic resonance micturating cysto-urethropy with retrograde urethropy and newer modalities. If you see that comparison, first, if you see MR, that is magnetic resonance micturating cysto-urethropy and retrograde urethropy, what are the advantages? Advantages are, first, these are very important, or these are most valuable for detecting congenital anomalies. So these can detect some of the diseases, like these can detect the any anomalies that a child suffers from, like congenital anomalies, or if the patient has posterior urethral injuries, any trauma case, whenever the patient presents with bleeding or retention of urine, in those conditions, whenever the patient has posterior urethral injuries, you can use this MRMCU and RGU for diagnosis. Similarly, if the patient has any urethral or periurethral, that is around the urethra tumors, the tumors which are arising from either urethra or around the urethra, in them we can do this micturating cysto-urethropy or retrograde urography. Then it is also helpful for analyzing or assessing the pelvic anatomy. For analyzing the pelvic anatomy also we can use this MRMCU or RGU. Then this also tells us or shows the extent of scar tissue. If there is any injury and that injury has resulted in fibrosis, then the extent of scar tissue, and also if there is any prostatic displacement, these can also be assessed by using these techniques. Then this MR urethropy, actually this is MRMCUG, but there is also one more thing which is called as MR urethropy. This MR urethropy is also more accurate. This MR urethropy is actually most accurate when in comparison to other techniques. In what it is very accurate in assessing the length of the obstructive urethral stricture. If there is a stricture in the urethra, and if it is obstructive, in order to know the length of the urethral stricture, we can do this MR urethropy can be done. Now, these are advantages. Now, what about the limitations or disadvantages? What are the disadvantages of retrograde urography combined with micturating cysto-urethropy? What are the disadvantages of RGU and MCU? Now, first, these both will not provide the length of the defect. What is the defect? If there is any poor prostatic urethral filling, if the urethra is not it did not fill correctly, if the contrast did not enter the prostatic urethra correctly or fully, in such cases it cannot tell the length of the defect in posterior urethral poor filling. Then it will also does not tell the extent of fibrosis, the amount of fibrosis that has occurred in corpora spongiosum, or if there is any displacement of the prostate. This cannot be assessed by retrograde urography with micturating cysto-urethropy. But if you remember these three, the length of the defect can be assessed by MRMCUG and retrograde urography. If these are done together, in such cases we can assess the extent of scar tissue or length of the defect, and also prostatic displacement. These can be assessed, whereas these cannot be assessed with micturating cysto-urethropy combined with retrograde urogram. Here one more important thing is if both these are combined, in such cases, if bladder neck is not relaxed, if the bladder neck is taut, If the bladder neck does not relax, then the stricture length is overestimated. Then here the stricture length is overestimated. If bladder neck does not relax, then stricture length is overestimated. Then next, what about the advantages of CT urethropography? There is also one more modality which is CT urethropography. So if you see the advantages of CT urethropography, if you see, this CT urethropography is more comfortable. It is actually more comfortable to the patient when compared to any of the above techniques. Next, second, it is also less time consuming also, because MR micturating cysto-urethropography takes lots of time, but this CT urethropography is less time consuming and it takes only seconds. This CT urethropography takes only few seconds for it to occur, to act. Next, this CT urethropography here, we can also compare the luminal size and stricture length uh, can also be compared. So you can also find what is the lumen or what is the tubular luminal size can be found, and you can also see the length of the stricture also can be found out very easily with the help of the CT urethropography. Then, if there is any extraluminal pathology, that is, if there is any tumor which is outside the ureter or urethra, or if it is any type of extraluminal, which is outside the lumen, if there is any extraluminal pathology, this can be detected with the help of CT urethropography. And it is also good patient compliance. The patient will like this procedure because it is more comfortable for the patient rather than micturating cysto-urethropography. And it is also able, we can assess the urinary tract completely. Assessing the urinary tract from kidney to urethra, the whole assessment of the urinary tract is very easy with this CT urethropography. So thank you.